Hey guys, Dr. Nate here at Thrive Dental and Orthodontics, and today what I'm going to do is I'm going to explain what is a root canal. So let me start off by saying that having or getting a root canal is never the most fun thing in the world, but if you're educated and you have a good dentist to help you out, it can be not so bad. So what is a root canal? Basically, a root canal is when you have a cavity that has gone too far. And sometimes you'll start off by having these swellings or you have this pain that may come and go. And people often go, oh, you know what, like I had this pain and I had a pain for like, 2-3 weeks. I took some antibiotics and now it seems like it's gone away. And they're like, hey, I think I cured my root canal. And I basically all the time tell them that can't really happen. You can't just take antibiotics and boom, your root canal or cavities are, they're gone. It just doesn't work like that. You're still always gonna have that base infection, and then the infection is gonna keep coming back. And sometimes what happens is you have this infection, it's getting swollen, just like you have a knee or an elbow or something gets swollen. If it gets relieved, and sometimes what happens is you get this kind of pustule thing that forms inside your mouth and it kind of pops like a pimple, it pops. So all that pressure you had from that infection pops and it releases and you go, I feel so much better, I must be good. And that's not really true at all. You just have this infection that now it's gotten so big, it's starting to come outside your mouth and it's kind of oozing inside your mouth, which is obviously not good. Hey guys, just a quick little interruption here. If you're in the DFW area, make sure to come into one of our offices. You get these cool, free Thrive Sonic toothbrushes. We're kind of located throughout DFW, so come on in. All right guys, let's get back to the video. So, what is a root canal? How can we prevent it? So, root canal basically is a cavity that has gone past the 2 layers of your teeth. So you have an outer layer called enamel and an inner layer called dentin. And then actually within that, in the small parts of that, in the in-between of your tooth, in the middle of your tooth, you have your nerves and your blood vessels. And what has happened is that cavity or bacteria or the acids are eating away your teeth, and they've eaten through the enamel and the dentin, and now they're into the blood vessels and the nerves. And that's called the root canal portion of your tooth. And so if you need a root canal, you can't just, patch that tooth up and kind of hope for the best, because now it's gone past the protective layers of your teeth into basically your body and it's infecting your whole body. So we need to treat that. And how does the dentist treat that? So what they do is they have to remove a portion of your tooth. And I know this is gonna sound scary, but remember, you're super numb. You can get nitrous, you can get all these types of sedations to help you. Anything you need that we have in here at this office. But what happens here, so say I'm gonna kind of focus on this. This is your teeth. This part right here, this tooth has now been prepared. So they prepared the tooth. They took away some of the tooth structure so that they can access the inner portion of the tooth. So when they do that, when they prepare the tooth, they access the inner portion of the tooth. They take these other things, and let's see if I can kind of get this here too. These are called files. Let's see if I can get them right here. Yes, these things, although it's really hard to see because it's so itty bitty, that kind of shows you how small your teeth are. These files go in the tooth. They go in where the nerves and the blood vessels are. Because what you have to do is those nerves and those blood vessels, they're infected. I mean, there's no way you can kind of come back from that. They're infected, so you have to take it out. And so they use these little tools, like those files there, to take out those nerves and fill it with something different called gutta percha. And that's just kind of like this rubber substance that takes the place of those blood vessels and those nerves. So once you had those out, you were pretty good. The dentist went in there, they prepared the tooth, they took out the nerves, they took out the blood vessels, they put some other kind of bleaches and stuff in there to kill out all the bacteria, to make it a good, clean environment. And then you just go, cool, we're done. But you're not quite done yet, because once we do that, you weaken the tooth structure, unfortunately, because you're taking out all the nutrients of the blood vessels and the nerves that were in that tooth. So what you need to do is you need to get something called a dental crown on that tooth. And this happens most of the time. Certain teeth, if they're not biting on and they're in the front, you may not need that, but majority of the time, especially if it's a back tooth, you're gonna need a crown. So the root canal portion is basically when the infection's gone so deep, you can't just put a crown on it. You need to go in there, take out the blood vessels, take out the nerves, and then put a crown on the tooth. And like I said, sometimes this is confusing because your symptoms may vary. Some people come in, boom, huge swollen, they know. They know it's either they need a root canal or they need a tooth taken out. Sometimes it's not so bad, they don't really feel anything. They said, hey, you know what? A year ago I felt something and it happened for a month or so, and then now I feel good. But there's still that infection there, and if you don't fix it, it's just gonna keep growing and growing, and then it's gonna come back, and it's gonna hit the other teeth, and it's also in your body, creating all these issues for your whole systemic body, so it's really important to treat. Does getting a root canal hurt? And this really depends on everybody. It's kind of like when people ask me, do braces hurt? If you get good anesthesia, the medication that they maybe gave you beforehand, the antibiotics or whatever they gave you beforehand kind of worked, and they give you an anesthesia and it's not too acidic of an environment because all the infection, then you get really numb and you'll be good. The other question is, how long does root canal take? And that really depends on the dentist. Some dentists, can do this. We just had one yesterday. Dr. Vu did a root canal build-up crown in, I think, 45 minutes to an hour, which is very quick. Some other dentists will take a couple hours, and it depends on the tooth too. The back teeth, way harder to do than a front tooth. The front tooth, sometimes dentists can get them done in 20, 30 minutes. Back tooth sometimes can take a couple hours. So it really depends on the tooth and severity of the infection. The other question people ask all the time is, how much does it cost? And a lot of this has to do with your dental insurance. Some insurances will cover the majority of it. So even if a root canal costs, $800 to $1,000, they're gonna pay $800 or $1,000 of it. So your out-of-pocket expense sometimes is just like $100, $200 or something like that. Some other insurances don't pay that much. They only pay 20% of it. So a lot of it depends on your insurance. But I'd say anywhere from $500 to $1,000 is pretty normal for root canal. And once again, it depends on where it's at. If it's more further back, in general, it's more expensive. The front ones aren't quite as expensive. All right, guys, there you have it. That is what a root canal is. I know it gets a little bit confusing, a little bit kind of crazy. But once again, if you're in the Dallas-Fort Worth area and you need some help, come on in, we'll help you out. And if you like these videos, please subscribe, and we will talk to you guys very soon.